Hello and welcome to the Microlearning series presented by the Refugee Health Program at the Minnesota Department of Health. This series is meant to help providers, clinical teams, and public health better understand best practices for refugee health screenings. This video is focused on malaria screening guidance during refugee health assessments. Refugees who are symptomatic for malaria and arriving from locations with endemic malaria should be tested for malaria. Also, those who are from sub-Saharan Africa and did not receive presumptive treatment should be tested or presumptively treated for malaria, even if they do not have symptoms. For those who are symptomatic, test using a malaria blood film and/or a rapid antigen test. For those who are asymptomatic, come from countries in sub-Saharan Africa and did not receive presumptive treatment, presumptively treat or test them appropriately. Always be sure to review any treatment contraindications. Malaria screening should occur during the initial refugee health assessment. Providers should consider malaria on differential diagnoses for those with potential exposures. This updated guidance reflects current guidance for medication contraindications and limits testing recommendations to those who are symptomatic and coming from endemic areas. The screening recommendations in Minnesota follow the CDC malaria screening guidance for refugees. Minnesota has a robust public health system, and providers and clinics are encouraged to connect with those resources to better aid partners and screening outcomes. Resettlement agencies may also be a partner during early resettlement. As part of the paperwork for the refugee health assessment that is submitted to the Refugee Health Program, there is a section where malaria screening results can be recorded. Please make sure this section is being filled out appropriately. If you're interested in learning more, please look at the full screening guidance and other resources outlined in this page. The well-being of all Minnesotans, including those with refugee status, depends on the work and dedication of our partners. Thank you so much for your work.